When couples struggle to conceive, one of the first imaging tests doctors request is an ultrasound scan. Ultrasound is safe, painless, and provides valuable information about the female reproductive organs. It helps the doctors assess the uterus, the ovaries, and surrounding structures to identify possible causes of infertility and to monitor fertility treatments. Hi, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. Today, let us look at what ultrasound can actually reveal during fertility evaluation. Number one, it reveals the ovarian follicles, that is the egg development. One of the most important fertility checks ultrasound can perform is follicular tracking or follicular monitoring. The ovaries contain small sacs called follicles, and each follicle may contain an egg. During fertility scans, ultrasound can show the number of the follicles in the ovaries, the size of the developing follicles, which follicle is dominant and likely to release an egg, whether ovulation is approaching, and doctors often use this information to predict ovulation timing, especially in women trying to conceive or women undergoing fertility treatments. Number two is the endometrial thickness, that is the uterine lining. For pregnancy to occur, the embryo must implant into the endometrium, that is the lining of the uterus. Ultrasound helps to evaluate the thickness of the endometrium, the endometrial plate, often described as trilaminar in fertility circles, whether the lining is adequate for implantation, because if the lining is too thin or irregular, implantation may be difficult. Number three is ovarian reserve indicators. Ultrasound can also provide information about a woman's ovarian reserve, which refers to the number of eggs remaining in the ovaries. During the scan, the sonographer may assess antral follicular count, that is, counting the number of follicles in each ovaries. The sonographer will also assess the ovarian size and the appearance. A reduced number of antral follicles may suggest low ovarian reserve, while a higher count may sometimes be seen in certain hormonal conditions. Number four is uterine abnormalities. Ultrasound may detect structural problems in the uterus that may interfere with pregnancy. And some of these common findings include fibroids, that is uterine myomas, endometrial polyp, congenital uterine abnormalities, adenomyosis, calcification. The list is long. Depending on the location and the size, these conditions may interfere with implantation or pregnancy development. Number five is polycystic ovarian syndrome. Ultrasound may also identify features suggestive of polycystic ovarian syndrome, which may be associated with hormonal imbalance. Typical ultrasound findings may include multiple tiny follicles in the ovaries, enlarged ovarian volume, a characteristic follicular distribution. These findings may help the sonographer evaluate conditions related to irregular ovulation. What are the types of fertility ultrasound we have? There are majorly two scans. We have the transabdominal ultrasound scan, where the probe is placed on the abdomen, and this gives an overview of the pelvic organs. And then we have the transvaginal ultrasound scan. In this case, the probe is inserted into the vagina, and this provides clearer and more detailed images of the uterus and the ovaries. Most fertility evaluations rely mainly on transvaginal ultrasound because it gives better visualization of the follicles and the endometrium. There is an important limitation to note concerning ultrasound. While ultrasound provides valuable information about the uterus and the ovaries, it usually cannot determine whether the fallopian tubes are open. Additional tests may be required to evaluate the fallopian tubes. To evaluate the fallopian tubes, doctors may recommend additional tests such as HSG, that is hysterosalpingiography, or sonohysterosalpingiography. Doctors may recommend the fertility ultrasound for primary or secondary infertility. That's a situation where a woman has never given birth before, or perhaps she has given birth once and struggling to conceive again. They may also recommend the fertility test for irregular menstrual cycle, suspected ovulation problems, monitoring fertility treatments, and recurrent pregnancy loss. Ultrasound plays an important role in fertility evaluation because it provides real-time information about the reproductive organs. From monitoring ovulation to detecting structural abnormalities, this simple imaging test can help guide doctors in identifying possible causes of infertility and planning appropriate treatments. If you are trying to conceive and experiencing difficulties, a fertility ultrasound scan may provide valuable insights into your reproductive health. If you have any more question or confusion, feel free to drop it in the comment section. And if you found this video helpful, don't forget to like, share, and subscribe. And I'll see you in my next video.